Hello and welcome to this training video on the Missouri Department of Mental Health Investigations Unit. I'm Mark Brennan and I'm Project Director for Continuing Education at the Missouri Institute of Mental Health in St. Louis, Missouri. And with me today is Scott Giovanetti, who is the Program Director for the Investigations Unit in Central Office. Scott has worked for the department for 16 years, with the first 7 years in the capacity as a surveyor with licensing and certification, and 5 years as an investigator for Central Office. For over 4 years now, like I said, he's been the Investigations Program Director. He has a master's degree in public administration from Southern Illinois University and has professional investigation training, including interviewing and interrogation, scientific content analysis, and St. Louis University medical legal death investigations. Hi Scott, how you doing?
Good.
It's
Glad
important.
to be here, Mark.
Thank you. It's important for you to share with us your information and your expertise regarding abuse and neglect investigations. And
I'll do what I can.
I think the first question that we'd have to ask you is for you to talk to us about the laws and regulations that guide the investigations unit in the Missouri Department of Mental Health.
Okay. The enabling statutes for abuse and neglect in the Department of Mental Health are in Chapter 630 and Section 100. So if you go, it starts around 630.150 through 630.170. Those are the supporting laws which guide us in our abuse and neglect investigations and the process in the department. And then, based on the statutes, we further define abuse and neglect in our department operating regulations and in our Code of State regulations, which apply to community providers or contract providers. That specific Code of State regulation is 9 CSR 10-5.200, and so that would apply to any of your licensed facilities or facilities out there serving DMH consumers that the department's funding. And your department operating regulations specifically are DOR 2.205, which apply to our state facilities like our MRDD rehabilitation centers and our psychiatric hospitals, and DOR 2.210, which applies to DMH employees that are processing community incidents and the actions they're supposed to follow through and procedures.
How do you report abuse and neglect?
In the department, there's several avenues as far as reporting. Some reports come through our Office of Consumer Affairs, and this is the Client Rights Monitor for the department. Other reports might come through the Department of Health and Senior Services Abuse and Neglect Hotline. And those are the minority of the reports that come through the department. Majority come through the specific divisions that are providing the service. So if it's community incidents in Alcohol and Drug Abuse Division, they'll usually come through there are 3 districts in the state, they'll come through one of the district administrators. If it's Comprehensive Psychiatric Services Division, those will come through the Support Community Living offices, and there are 5 or 6 of them around the state. And if it's the Division of Mental Retardation, Developmental Disabilities, those will come through usually one of the 11 regional centers around the state. And there are a few, if it's a state facility though, the employee or the consumer may report directly to the facility head or a supervisor.
Who investigates abuse and neglect?
If it's a department abuse neglect situation, it'll be done by usually state employees in the department. There are some contract investigators that the department does contract with to conduct those, but majority are state employees, and their majority are local investigations, which when I say local, I mean investigators are located within the divisions at these specific regional centers or locations, facilities. And there are some investigations that are conducted by Central Office, and these are usually more severe in nature.
What would be an example of one that your office would do?
Okay. Usually if there's a sexual abuse allegation where there's an allegation of sexual activity between a staff and an individual receiving services, that's something that would be a Central Office investigation. Or some serious neglect issues, someone being hospitalized for neglect, or physical abuse, someone being seeing a broken arm, something like that. It's going to have to be something pretty serious in nature.
Okay. What happens once an investigation is complete?
The investigator, once they are completed, they'll write a report, and this report will be given to department administration. So it's usually someone within that specific division that will read the report and draw some conclusions from that report. They're either going to make a determination of abuse neglect, or they may see some areas that the system could be changed, some service improvements, and request a plan of action from a provider, or implement some personnel changes if it's in-house, do something that might prevent such situations in the future.
And who can obtain an investigative report, a DMH investigative report, and what does it look like?
Okay. Parents or guardians can obtain the report. We provide the reports to other state departments, depending on the situation, law enforcement, if there's possible criminal activity. The report is usually used by whoever's representing the department in hearings, such as the Attorney General's office or Department General Counsel. The report is essentially a very standardized structure. They used to look completely different around the state within the department, and a couple years ago we developed one standardized format so it would be easier for folks who use the reports to be more familiar with how they're formatted, and also such folks like attorneys in the Attorney General's office that use them in hearings. And they're structured in that there's usually just demographics up front regarding the individuals involved and the fieldwork dates, the folks that were interviewed during the investigation, and then mainly the body of the report is whatever was observed, the testimony that was received, or the documentation that was reviewed and what it showed. And then you have a significant findings of facts section at the end. And this is where the investigator, based on the facts in the report, summarizes what they think are the significant findings of the investigation. It's nothing where you come to conclusions or make recommendations, but you're just pointing out what you think are significant facts for the reader.
Oh, can you talk to us a little bit about a disqualification registry? What is it?
Okay. The registry was created because there used to be laws in place, and still are, that people would be disqualified for committing certain abuse and neglect acts. However, if they were disqualified, they may be able to pick up, move to another part of the state or a different division of the department and gain employment, and the person that wherever the abuse and neglect took place may not be aware or be able to communicate that to a potential employer that might hire them somewhere else. So we needed one central list that everyone could refer to know that folks are disqualified from working with department consumers. And that was the creation of the Disqualification Registry. It occurred in 1997.
Oh, and that's kind of like checks and balances almost, so that people who shouldn't be employed aren't employed.
Exactly. This gives everyone an opportunity during the application process to screen for someone's name on this registry.
Can you tell us a little bit about what the difference is between how the Missouri Department of Mental Health operates abuse and neglect versus perhaps other departments such as the Department of Health and Senior Services or Department of Social Services?
Okay. First off, we have a difference in definitions. So with different state laws, they developed slightly different definitions for each department, and so that may drive who would investigate the situation. One department may investigate if a consumer is receiving services from several departments, whereas another department may not in situations. Sometimes there's joint investigations. Really how we operate differently are in the Department of Mental Health, the investigators are usually either full-time staff, could be some part-time staff, whereas in the other departments, sometimes surveyors, they wear two hats and they're also investigators, and they do that a little more frequently in Health and Senior Services. And there's also a different focus in that in the Department of Mental Health, the investigator writes the report, but they do not come to a determination. That's made by administrative staff. Whereas in the other departments, the investigator may be the person who makes the determination whether abuse and neglect occurred or not.
Do you monitor trends of abuse and neglect?
Yes, we do. And we do that through the Incident and Investigation Tracking System, which some folks refer to as ITS. It's every allegation or suspicion of abuse and neglect, every investigation that occurs in the department is entered into this database. And there are other such incidents entered, such as deaths of consumers, so we can track around deaths. And this system tracks from the incident phase through the investigation process to actually the appeal process and possibly placing someone's name on the disqualification registry. That's all part of this database. This database can generate standardized reports that we can analyze to look for trends in the system.
Well, that's a pretty important system to have in place, I would think.
Yes.
Can you talk to us a little bit about any trends that have been identified to help prevent abuse and neglect?
Okay. Some of the things that we've seen as problems, and not necessarily coming from the IT system, but generally out in the field as investigators, first might be adequate orientation or refresher training for staff. You know, our folks, when they come in, are they getting information on what is abuse neglect? How do I report it? You know, are they getting information as far as are they getting proper training around, let's say, initiating CPR measures in a medical emergency? So that they can adequately respond to a situation. Are they getting refresher training, such as if someone receives physical restraint training when they're first hired, and then let's say they become supervisory staff and they come back years later and again providing hands-on direct care. If they're going to be involved in a physical restraint situation, have they received some updated training in that area? And they may not have. Another area might be responsibility. Is it clear to all the staff what their responsibilities are? So if you have a situation where you have a serious incident occurs, does everyone know what they're supposed to do in that situation? Another area might be, are the staff familiar with the history of an individual? Has something been lost through all the records, updating of records, something gets lost that, let's say something like a choking risk, and a person has a history of choking, let's say specifically on peanut butter, and staff were aware of that and wouldn't serve peanut butter for a certain period of time. Then over time, new staff were hired, records were thinned, and maybe that wasn't kept in the most current records, and staff then aren't aware of it. Or even if maintained in the current records, possibly the folks aren't keeping current on reading the records and being aware, very aware of each individual.
That's really important information to have, I would think. Can you talk to us about any initiatives that have recently been initiated in the department? Sure.
There's really two main initiatives going on right now. First is, I talked about the incident investigation tracking system. The scope of that's really being expanded to not just capture abuse, neglect, and deaths, but also to capture every incident that is required to complete an incident report on the department. So we'll have more information in this system, such as medication errors or injuries to individuals, that we can then analyze and look for trends. So also the important piece of that is this will be a department-wide database. So whereas you may have certain facilities now capturing this information, it's only captured at that local level, and it's not, you can't look across that division or across the department. This will be a database everyone utilizes in the department to capture incidents around, so we can get department-wide data and trends, and we can get division-specific or even facility-specific and compare facilities even.
Sure.
Another important initiative going on is the Investigator Credentialing Initiative. This is something that will be started this summer, where every person that will be conducting investigations will have the opportunity to become credentialed, and this is where they'll go through 3 days of training. Very intense training that's department specific, how to conduct department mental health investigations, and utilizing a lot of techniques that are national level, but also tailoring them to the needs of individuals and specifics that we encounter in department mental health investigations. At the end of that, they will take a competency-based test to prove that they've mastered the material and can become credentialed. So it's an important initiative in that everyone will get a baseline level of training and can exhibit that they've learned that material and give them a start on conducting investigations.
Well, Scott, if you could sum up what you think are the most important points for people to remember about abuse and neglect investigations.
Okay. Really, what's really important is to identify and be trained on what is abuse neglect, what are the definitions, how do I report abuse neglect, and also as far as performance measurement. That's really the area we're moving towards in the department. Instead of just monitoring process and evaluating process, we're looking for what are the outcomes. How can we measure the performance? How can we improve upon services? And so you see this going on in many areas of the department. It's also going on in the abuse neglect area.
Oh, thank you so much, Scott, for coming in and talking with us about this most important issue. For you folks out who are watching this video, I encourage you to know your own facility's policies and procedures about abuse and neglect. Identify the different characteristics of those in your facility and make sure that you report as you need to. If you take a good look at the key concepts and the glossary of terms, you'll have no problem completing your test. Good luck.